This is Steve. Steve, do you mind if we show this video to other people?
Sure,
Like on our website or Facebook or something. Okay. Tell us your story. You were in a couple of days ago. What was going on that brought you here?
Well, about 2+ years ago, I just simply stopped walking because, at least without pain, because the groin area was really sore on the right and just locked up, and I had constant pain virtually every time I moved my right leg. Well, after one manipulation here, it took an hour. You were very generous with your time. I went back home and I told the family, I said, hey, I can walk. So yesterday, the day after the manipulation, I walked a mile in joy. And I could never do this.
So, you came in here almost limping yesterday, or 2 days ago.
I did. My right foot was dragging and in pain.
So where had you gone to get help?
Well, I've been to several chiropractors, and they basically didn't really help me. And so our son-in-law found you through a gentleman you know up in McCall. And David...
Another chiropractor.
Another chiropractor. Right. David had a biking accident at Tamarack. He went over the handlebars, went up there to this gentleman. He knew you. And so David came down here, and then David was so happy after his first visit. I said, I've got to call him. Right. So 2 days ago I was in, and honestly, I can walk. There's still pain, but it's about 25% only of what I had.
Well, your daughter said that you went home and said, he watched me walk.
Yeah,
which is a novel concept if you have a gait problem, right?
I thought that was profound. He actually asked me to walk. I said, yeah, I can't walk. And you're asking me to do that, and that's the whole issue. So you had me walk down the hall probably like a duck, dragging that right leg, and I couldn't move my right arm because it hurt in the groin.
So do you mind if I tell?
Yeah, go ahead.
Okay. Steve had some problems with his big toe on the right side. His big toe wasn't moving, which was causing him to alter or pick up that leg prior to when he should be engaging different muscles, which has caused a lot of inflammation and a lot of pain. That was part of the problem, but the other thing was the actual hip socket wasn't moving right and was kind of stuck. Well, thank you for sharing that, and hopefully other people see it and say, hey, I know somebody who can use that help.
And one other thing, very important, because I was told by somebody else, 99% sure you'll have to have a hip surgery.
Oh, that's right.
99% sure. And I really respect this individual. I've been to him before. But I thought, hey, I'm not going to do that. And
I'm not ready for that.
I'm not ready for that. And so, anyway,
not going down that
what
way.
a relief. Thanks, sir.
Thank you, Steve. Thanks for sharing.